Before we start, check out my brand new 40-120 transformation program, the ultimate fitness coaching program for men over 40. Click the link in the description to learn more about it. Okay, how do I get the best out of my doctor? And the reason why I went to the doctor a couple of weeks ago for my foot, I walked in. I wasn't really prepared with the questions. He kind of stressed me out. He was in a hurry. I semi-asked questions. He kind of diverted, and he was like, he was kind of in a rush and in a go. And once I got out of the room, all the questions came to my head. Everything was more clear. And then that's when we started talking about how do we talk, like how do we prepare when we see a doctor? I know it's a silly, it sounds like a silly question, but I often hear people who talk about it. So what do we do prior to meeting our doctor?
Prior meeting your doctor, you need to be prepared. You said it, you were not prepared.
Yeah.
Okay, you need to be specific. Doctor, hey doctor, how are you? Okay, I am here today for this, and that. If you have multiple problems, if you are, let's say, in a walk-in clinic, in Quebec now is one problem. So you go specific to, okay, I'm here for my head. Okay, I have this and that on my head. The schedule. What happens? Okay, is there any specific thing that draw you back to that specific problem? Let's say if it's a pain, did you take a medication? Because if you come to me saying that I have this headache, okay, it's so severe, I didn't take a medication. You didn't have a severe pain enough to trigger the need of taking a Tylenol in you. Now you come to me saying that you have severe pain. Okay, so also you have to ask questions. Okay, you need to be specific about your symptoms. Said what you did. Okay, what you did before seeing your doctor.
So I should have all this logged in when I go there.
Yes,
But-
not
but-
even logged in. Just walk him. You need to walk him through what happened to you.
But I find some doctors, like I know you're like patient. I know you care. I look at my girlfriend, she's the same way.
Exactly.
But you see some doctors, they're like, it looks like they're looking at their clock and they're like, okay, I got 10 minutes to do this. So
Well, even if you got 10 minutes to do this, if you're taking care of one problem, you have time to discuss with your patient to address their concern properly. You need to be respectful to your patient, and the same. Respect is a two-way street. Okay? So you need to ask them a question. What does this concerns you? If your doctor doesn't ask you that question, your doctor will not understand anything. They need to ask you, why does this concern you? Okay? What do you expect from today? Because I cannot take for granted I know your expectations.
good point. Good point.
Okay? You might come for your food. You might tell the nurse that you came for your food, but you came for completely something else, that you were not open enough to the nurse, telling her, well, I come for STI testing today.
Yeah.
No, you will never say
You'll
that.
never say that.
You say,
Yeah.
I have a food pain.
Yeah.
That's easy. Okay. And also, you need to be prepared. You need to make sure of follow up. If you are concerned about follow up, ask your doctor, will I have a follow up?
Yeah, it's true. We should ask him. It's true. I
Will I have
normally
a
don't.
follow
Yeah.
up? Okay. So be honest. If this is very distressing to you, you need to tell your doctor, because as a doctor myself, I can see through your head.
Yeah.
Okay. If you have a problem, you cannot tell me specifically. Do you think I just have a stethoscope?
Yeah.
I don't have a magical wand. So I'm not a magician. I'm a doctor.
How long, what is the, How long do doctors normally have? Like, do you have you?
It depends. It depends.
15 minutes.
It depends. Depends on how the doctor practices.
Okay.
Myself, I practice as a. I do volume. As we say, volume is. Some doctors will do 10 minutes appointments
10
in
minutes.
walk-in appointments. I will see 5 patients an hour, and I will tell you, all my patients will come out happy. Yes, I booked you for 10 minutes, but if you need 20 minutes, I will gladly spend it with
Okay.
you. Because if you have a problem that requires 2 minutes, okay, it takes 2 minutes. So I will save 2 minutes from the other appointment and spend 20 with you if you need that.
Yeah.
I cannot treat your anxiety in 10 minutes. No,
Yeah.
impossible. I need to.
But I think that's that I think you as a doctor have that, but I guess it's a personal thing per
Yes,
doctor.
yes, because I cannot ask everyone to be like me, okay? To be efficient as the same and be a person at the same time, at the same time. And as a person, as a patient myself, I have a fabulous family doctor. She's the best. Uh, I will name her Dr. Busherman. She's the best. I love her so much. But I understand why she is late. She spent time with you.
Yeah. And that's the part where I'm like, damn, my appointment was an hour ago and I'm still waiting. And
Yes,
I
because that doctor, two things might happen. That doctor, well, many things, let's say. That doctor might go take a break because as persons, we need break too, you know. Might have colleagues asking questions all around. Might go for a laugh with the nurse. Okay. Might have another patient who needs more time.
yeah.
That's the most usual one. Okay. And sometimes you just need to, to talk about it. You just had this case and you go see a colleague, to vent about this.
Yeah.
Because sometimes some patients can be so disrespectful that you cannot lash out on them.
Yeah.
You go vent with another colleague.
Point.
Okay. So that's my experience. But let's say make sure about your follow-up. Make sure that you understand how to take a medication that is given to you. Most doctors will tell you, the pharmacist will tell you.
Yeah.
I
Because
did that once. I
yeah.
did that once, and something bad happened.
What do you mean?
I gave a medication to my patient, okay? I didn't have the whole file, the whole pharmacology, the whole pharmacologic profile of the patient. I
Okay.
gave a medication that was contraindicated in her case. And I told her, well, I think if there is a problem, your pharmacist will pick it up and send the fax to me and not serve you the medication. The pharmacist did not pick it up. The pharmacist served the medication, and my patient ended up in a hospital. When she came out, she called me, telling me, Doctor, the medication that you gave me was contraindicated. I was like, oh, because of what? Tell me. I was taking this and that medication. I was like, well, I asked you, but you never mentioned that to me. And it was not in DSQ, the Quebec system.
Yeah.
And the pharmacist called me. Well, doctor, you gave that medication that was contraindicated. I was like, well, that's why we have a pharmacist.
Yeah.
He's like, I'm like, exactly. She might sue you. Do you know that?
And you talked about that, like don't underestimate the pharmacist. Like not don't underestimate, but like
The pharmacist is supposed to be
yeah.
your backbone. The person's supposed to have your back every single time. But my pharmacist failed this time.
Yeah.
It happens. It happens. And I sat down with him. We discussed. I told him, well, this is the Swiss cheese model. If I miss something, you catch it. So he was like, well, I'm sorry. Well, I'm like, well, don't tell you're sorry to me.
Yeah.
Because the patient almost died.
Yeah.
She's the one you need to apologize to. And finally, she didn't sue him because she said to me, he admitted that he was at fault.
Okay.
That's the thing. Always communicate with your professional. Any problem that you might feel, any counter transfer, let's say, that you are in a clinic studying something and you feel that your doctor is judging you,
Oh, yeah, I get that.
out loud, voice it. You should voice it.
Right.
You should, doctor, did what I say triggered something?
Just straight out and say it.
Yes, say it, and the person will understand that you did not feel safe at that specific
I have a question.
moment.
If I like to go get a second or third opinion,
Yep, it's okay.
right?
It's your right.
I know it's a silly question, but do you tell the second doctor that you got a second opinion or a third opinion, or do you like you're like, I went to see another doctor, he said this, what do you think? Like,
If you say that, the doctor might feel shy about giving you the right information.
okay.
Some doctors will, but I won't. Because I am the kind who will tell you, well, why did you come see me? Did you see anyone else about this?
Okay.
Because if you tell me that you have a problem, let's say that you have a pain for the last 6 months and you had access to doctors and you didn't see anyone about this, and you tell me it's a severe pain, I will ask you, did you see anyone about this? Did you even talk to your pharmacist? Because your pharmacist is close to you, eh?
Yeah.
You should at
But
least
we
speak
don't. But
with
we
them.
don't see them as doctors. We don't see them
They are
as
not doctors, but they can't make a diagnosis. Let's say they don't have the right to.
Yeah.
But they have, a good education
Okay.
to guide you to the
Right.
proper resource. Okay,
Okay.
to tell you, well, if I were you, I wouldn't take this or that. Let's say that you have a flu and you are
The flu, yeah. The flu, yes.
and you
Then,
have
yeah.
high blood pressure.
Yeah.
You cannot take or should not take any medication that is over the counter
I
because
didn't know that.
most of them will make your blood pressure go wild.
Okay.
I see that in emergency all the time because people will come and I had this flu. I took this and that.
Wow.
And today I have a high blood pressure. And the nurse will write diagnosis of high blood pressure because the high blood pressure is 180 over 100. Yes. And I will ask you, well, did you take any medication? Can you show me what you took? They'll say, oh, I took this and that. It has this specific compound in it that will make your blood pressure go wild. And I tell them, well, I think this medication is doing this to you. If I were you, I would not take this. I would take a specific Tylenol. I will make sure that I drink enough water and I sleep. That's a specific issue. But let's say that you come to me for a problem. You are not specific enough. When I ask you about the symptoms that I think might accompany what you have, okay? Let's go back again. You come see me, you need to be specific. That happened 10 days ago.
Yeah.
It came with this, and that. The schedule is this and that, okay?
So I think you almost need to write it down because you're gonna forget that if you don't.
Well,
Like, be
if
really.
you walk your doctor through,
Yeah.
you will get all the elements easily. Just walk him back to what, or her back to what happened to you, period.
Yeah.
Just when I see that a patient is a bit hesitant about the information, I ask them, well, walk me back through that.
Yeah. Good point.
They will tell you, okay, that happened, that happened. Okay, I had this and that. I did this and that. When I drank water, it get worse. Okay,
Yeah.
that's an example. When I go do this, that. Okay, fine. And what did you do? Did you take a medication? Did you see anybody about that? And most people, what they should not do is read Google.
That you nailed it. I know
They read
a
Google.
few people, and
and
Google's when you
come with a diagnosis.
it always comes with it always you got cancer.
Never
Every time you Google
go
anything, you're dying.
to your doctor with a diagnosis. That's the worst thing.
Okay.
Never do that.
I've done that.
Okay.
Well,
If you
look,
do that,
I
your
checked
doctor.
Google and I think this is what I have. And he's like, okay.
No. I will. If
Now
you
my wife is Google. I'm like,
you yes, tell your doctor. My wife is a doctor. I spoke to her. She thought I might have
yeah,
this.
not
Guys,
Google.
never take that from a doctor. Never tell a doctor, these other doctors say that I have this. What do you think? Okay, so why this other doctor did not treat you?
Yeah. Or what did he treat you for? Or why are you here then? Like,
Exactly. So if you knew what you had a doctor who gave you a diagnosis. The doctor who made the diagnosis is responsible for the treatment. So let them treat you. I had a lot of immigrant patients who have access to their doctors in their country
it's
back
true.
there,
Yeah, you probably get that.
and they will do a telemedicine. The doctor did not evaluate them properly. Will tell them you have this
Telemedicine meaning just virtual.
virtual medicine. Okay, or they have access to a cousin via WhatsApp or whatever, and or Facebook, and they text with them. He says you have that. Okay,
Without just based on what they say.
based on what they say, and they will come to me. I will tell them, well, that can be many things because there is that thing in medicine called differential diagnosis.
Okay.
Differential diagnosis, yes. Ha, knew something?
Something new.
Yes. My friend, a differential is many other problems that can cause the symptom that you're having this day.
Okay.
Let's say that you have a headache. A headache can be secondary to your vision. A headache can be secondary to a trauma. A headache can be secondary to migraine. A headache can be secondary to menses. Headache can be secondary, glaucoma or sinusitis, otitis.
Good point.
Okay? A lot of things can be part of that. Or let's say that you have cold symptoms, you might have headaches too. Headache itself, it's not a diagnosis,
Yeah.
it's a symptom.
Symptom, yeah.
So when the symptoms comes on, we need to differentiate. Okay, we need to know what it comes with. A headache can be a stroke. You don't want that to happen to you. So when you put headache on Google, you put worst headache of my life.
Yeah, it's
it
like
will tell you
you're dying.
aneurysm.
Yeah.
Your aneurysm is bleeding.
Yeah.
And my friend, if your aneurysm is bleeding, you would not be here.
And I tell people, get off that Google. Because at one point I was like, checking stuff and it's always like cancer, death, cancer. So I stopped watching.
It's okay.
Stopped,
Okay to check. It's all right to have the good information. But as doctors, we need to provide you to the good sources. We need to tell you, well, I don't think a general Google search might give you what you're looking for. Okay? We can go this or that site. Okay? We have many, many sites that can help. Okay? Can help you with what you're having, what you're going through, can give you even ideas about what to do before you go see a doctor. If you have this or that, go see a doctor. Let's say that you told me, I've lost consciousness 6 days ago and I didn't go to emergency. I'll be like, oh, I will send you there then.
Yeah, right away.
Right away. You lost consciousness. That's what you told me, eh? But we still need to differentiate. What does that mean to you to lose consciousness? Could you hear people around you? Were you completely out? Okay. What did you do after? What happened before? What happened after, during? Did you have any, did you have any seizures? If you say that, I will have, okay. I think we have an emergency there. I will send you to this or that place. I will tell you why I take the decision. And always make sure that before taking a medication, make sure that your doctor tells you about other things that you could do.
Good point.
Okay, do not mix your medication with over-the-counter things. Let's say,
I guess in that case, the best thing to do is ask your pharmacist.
Ask your pharmacist.
You're not
Always,
sure. Yeah.
always. If you are taking even a Tylenol a day,
See, I wouldn't
make
think that.
sure that you talk to your pharmacist before taking any herbs and plants from Amazon. I don't know where, or any
It's
other
true, huh?
site
It's true.
that you can buy it. They will tell you boost your testosterone up with this or that.
Yeah.
So myself, I will be, very conservative on this. As doctors here in Quebec, it's a reality that we have to do volume. The government pushes us to do volume, okay, to see more patients.
Yeah.
Our system here is based on quantity, not quality. I'm from a system that was based on quality.
That's in Haiti you're talking.
Yes, sir.
See, you think it's the other way around.
Yeah.
You think like,
Yes,
okay.
sir. I was not even in Port-au-Prince. I was at Hinge. It's part of the northern part of the country. I was close to DR, to Dominican Republic, and most people there speak Spanish.
And you could tell me.
It was quality.
Yeah, quality. Wow.
Yes, sir. It was quality. If I have my patient come to my emergency, if it takes 1 hour to see my patient, I will spend 1 hour with my patient. Okay. Yes, I will have a team around me. I will delegate things to be done, but I will not throw my patient around, say, go see your family doctor. Who is that family doctor?
Good luck getting one too on top of that.
Yes.
Good luck getting one.
Most people now a lot of us do not have a family doctor.
Why is that? It's because we have a shortage of doctors, because they leave. It's because
there is a problem here in Quebec.
Private.
We go private because sometimes RAMQ, okay, the government, we find it annoying. It's very annoying that you saw a patient. Let's say that you saw a patient for 30 minutes, okay? You build a RAMQ for that period of time, and they decide not to pay you.
And why would they do that?
Because they decided they won't pay you.
Wow. Okay.
Period. And it's your, you need to prove that you did that.
So I guess that's one of the reasons why
That's
this is
one
happening.
of the reasons. It's always difficult sometimes. Let's say that I work for let's say for 2 weeks, that I build 17,000 for 2 weeks, and I got bid 15,000 because RAMQ decided, this is that. There is always a problem. And when you bill it again, they usually pay you, but sometimes they won't. Let's say if there is a small problem, okay, in the system. Let's say we have a lot of immigrants here. They don't have a RAMQ yet, but they have the right to book in a GMF in a clinic. When you see them, you should build a RAMQ, right?
Yeah.
They will tell you they are on account, so we can't pay you. Can you call that person who has difficulty to go to the supermarket and ask them, well, you will need to pay me?
Yeah.
It's okay.
Yeah,
I will let it go. It's okay.
I'm sure it's not easy, especially with people
that part. This is my reality, sir. That's what I had to deal with every day. So I'm still doing this because I chose to do it. But I cannot blame other doctors who decided to go private. They know how to count. It's okay.
Yeah, that's how it is.
And let's say you work weekends. Some doctors don't want to work weekends.
Yeah, it's true.
Specifically, younger doctors under 30, they will not work weekends.
Yeah.
No.
They're not the old school that would
the type of doctors who will work every weekend like me. They are not the kind. They will tell you, no, it's quality of life. And I agree. Yeah. It's QOL every day. Every day. Yes. But your doctor is also a person, okay? If you feel there is something, there is a conflict, voice it.
Good.
I
think we're so intimidated to voice our
You
our
should
opinion on
not be.
a
You
doctor.
should not be. You should not be. Voice anything that you feel that your doctor does not understand. Because if we understand you, well, to help you properly, we need to understand the scope of your problem. If you come to me with something that I might think is small and is affecting you, your family, your work,
good point.
okay, people around you,
Point.
it is not a small thing. You need to let me know that it affects them. And if you have someone that can come with you, someone that you are
point. Never
okay
thought
to
about that,
speak, to speak about your health in front of, you can bring that person with
point,
you. And as a doctor myself, I will ask the person to present themselves, who they are to you, and ask you,
why do you want them there?
no, if you agree that we speak about your health in front of that person, and that I will still ask it because I might ask some questions that might be, a bit intimate questions to you. Well, can I ask all type of questions in front of that person?
So I think that's something that I never thought of, like bringing somebody there. And I think
Yeah.
what I got from this next time I see my doctor is really be prepared with
Make sure.
the questions, what medication.
Exactly.
If I feel symptoms, write them down, what they felt like, what happened.
Exactly.
Really log it from the moment it happens and go there.
Make sure that you walk your doctor through the event that happened because we can't know it. We were not there. If you are a poor historian, what happens? That I treat anything. Okay? Some patients get annoyed when you ask them more questions. I had that almost every day. Why do you ask me so many questions? I'm like, well, because I need to understand.
Absolutely.
But I told you that I have a headache. I said, well, okay, but is there any relation with my menses? Why are you asking about that? I'm like, well, because sometimes it does.
Yeah.
Sometimes it.
I would find that odd. The person who's annoyed of you asking questions. I'm like, I want to give you all the information I could because there's questions I'm not going to think about.
Because you're over 40. If you were under 35, you will feel it very annoying.
Good point.
If you are a Gen Z, you think doctor is like TikTok, okay? Because you find some professionals on TikTok taking their time on TikTok instead of seeing patients, okay? You think it's easy.
Good point.
It's not. I'm not generalizing here because I know some of them might be good. Okay, I've had colleagues that are Gen Z, it's fine. But when you have some patients that are annoyed about questions, they are either older people, very old, like 75, 80, who doesn't have the energy to tell you all about it, or they are in their 20s, annoyed about that. I have to go see my friend. I have no time to see a doctor. So, yeah. So that's how it is. Let's summarize by saying if you're seeing your doctor, be prepared. Okay. Also, make sure that you walk your doctor through your symptoms. Okay, the schedule, what makes them worse, what makes them better, what did you do? Okay, be open.
Good point.
Do not come with a diagnosis. Be open about this. Make sure that you give informations and we can educate you. Okay, another thing, make sure that you ask questions about the medications that they are giving you. If there are any other medication that you can take. Not all the medications works for everybody. So if I had this problem before and took this, it worked. I will tell you, I had this problem before. I took this, it worked. What do you think? Good. And also, voice all the complaints that you have, any concern that you have. Make sure that your doctor understands the scope of your problem. Because for us, c'est pas grave. Okay? We will tell that to you. If we don't understand, well, c'est pas grave. So, if it's not, make sure that you talk about follow-up. Doctor, will you call me after my x-ray?
Good point. Good. Are you going to call me?
The doctor might tell you, if your x-ray doesn't show anything that will change my management, I won't call you. That's what.
Okay. That's a good one because that I
Yes. If it doesn't change my management, do I need to call you? No, I don't need to call you. I will go to the next. And if you have anything else that you would like to discuss with your doctor, make sure that you voice them. Make sure that you are respectful to your professional, and make sure that he or she is respectful to you, because respect is a two-way street, guys. So, well, if you guys can do it like this, you
Yeah.
would be ideal patients. Okay, because I'm not ideal. Okay, because as doctors, we are persons too.
That's true.
We have problems. We might think about something else. If you don't walk me through it, I will not know. So I think what people need to know about this is to make sure that you walk me through what happened to you, how it affects you, how it affects your life.
Good point.
Okay. So what you can do when you have this, what you can do. So what do you want to live with? What is your expectation? Because
point.
when you don't tell me what you expect from this appointment, I will not know what to do for you. And as doctors, we're supposed to ask you that question. Did you expect anything specific today? What do you expect from this appointment? And all of us, we learned that in med school and residency, okay? But not all of us do it.
I think if I got something out of there is to have the confidence to speak to my doctor and
Yes.
say, today I'm here for this reason, this like, and really have a summary, come in knowing
Doctor-
I think I'm going to practice the pitch before to make sure it's on point.
Exactly.
And then just come in there and just
Consider like you were speaking to ChatGPT, okay? The same way you ask questions to ChatGPT and it gives you a lot of answers, I think your doctor might do that. And your doctor is supposed to be the source of your good informations. Not all doctors have all the answers, okay? As doctors, we don't. And when we don't have the answers, we can tell the patient, I don't have all the answers. I will send you to someone who might have them. So
Perfect.
as professionals, we need to be honest too.
I love it. So, guys, I hope you enjoyed this episode of Man Yourself Up. Today was a great episode. It's something I
was
didn't
great.
think we'd be able
I
to.
loved it.
We got a lot of information that I know I'm going to use. I know people are going to watch, are going to be
Yep.
prepared for next time. Hope you guys enjoyed this episode. Make sure to subscribe, hit the bell, leave us a comment in the box, and we'll see you guys next week.
See you next week.